Hi, everyone. Welcome to another episode of Breaking the Chain with Caitlin, a digital story vodcast. Each episode, we explore unique roles of various healthcare workers relating to infection prevention and control practices. I'm your host, Caitlin Cosgrove, and today we'll be talking about infection prevention and control practices in rural Canada. So now it's time to welcome our guest, Logan, who is here to share expertise on this topic. Hi, Logan. Welcome to the show, and thanks for joining us today.
Thank you very much, Caitlin. Pleasure to be here.
Would you be able to start us off by sharing with our viewers a little more about what you do?
Certainly. So I am a public health nurse at the Temiskaming Health Unit located in Kirkland Lake. It's about 50 kilometers from Quebec, just so you get an idea where I'm at. And I have been a public health nurse now for about 19 months in this area. This has been the first job I've had since I finished school. And my role as a public health nurse for the past little while, I've been in two departments for the most part. I was in school health for about 9 months, and then I moved over to growth and development for a number of months. But now that we're in the middle of COVID, my certain roles involve doing in-house vaccine clinics for everyone except for babies. I haven't got that expertise yet. I've given the COVID vaccine. We've been having access to the Moderna vaccine up here, so I do a lot of immunizations as well as education around it. And I'm also responsible for doing case investigations and contact outreach around COVID. So there's a lot of discussion around that. So those are the three big areas that I cover these days.
Wow, thank you so much for sharing. I know, since I'm from an urban city, so seldom do we get the chance to learn about nurses like yourself. So I'm really excited for today. So to start us off, what is your role as a public health nurse in a rural healthcare setting in regard to infection prevention control practices?
The main responsibilities that I have, especially in the roles that we kind of just discussed, is very much around health promotion primarily. I find that's one of the biggest topics that I do, especially around when we're talking about COVID or vaccines and everything else there. So health promotion with injury prevention, and it's all sort of implemented through a lot of educational discussions with people. Obviously, besides doing regular practices around immunizations and doing case investigation and endless documentation, it's very, very much most of the work that I would say about 50% of the work that I do is really about interacting with people, which I adore beyond description. That's a huge part of public health. The only challenge now, because the way that public health really works is you have to take a public approach. So we're talking about larger community volumes of people. So I've had the good fortune of actually doing larger discussions and larger educational sessions with like older adults around COVID and management and everything else. But in a lot of cases now, we are doing more individualistic sort of education, which is still incredibly valuable. But it does sort of go against the whole premise of public health. You want to think about the public as a whole versus the individual itself. And then that's, you have to sort of adapt as you go along. So right now, that's really what the overall extent of it is. There's a lot of education, but a lot of what I'm trying to do now is take a more active listening role to learn more about people's views on this, because there's endless questions around COVID, which I'm sure you're aware. So it's a balance of those two things, really.
Wow. And how was your role in infection prevention and control different in the rural community where you're at versus an urban setting like Toronto?
One of the advantages of working up here, especially because like the population of our entire district, which is spread over hundreds of kilometers, is a little over 32,000. But in my community itself, most people actually know who I am. So I have a rapport with a lot of people that visit the health unit because I've immunized their kids, or I've spoken to them about vaccines, or they've called me on the phone and asked questions. So I am in a slightly, I think, better position to build that rapport with people. So then I find that people will call me on random topics that I know nothing about. And I'm like, well, it's very sweet you reached out, but I don't know this area. So that is one big advantage. And I imagine that's a bit of a challenge when you're in an area like Toronto, where the population is in the millions, or the tens of millions for that matter. But one of the also big advantages of that is I get to really sort of understand what sort of learning style the individuals I work with have. Most of them, we have sit-down discussions. I explain how infection control works, especially if it's with a young child. But my role has been primarily doing it through, yes, face-to-face discussions when we do vaccines, talking about infection control. And then when I do it with case investigations or contacts around COVID, it's much more in depth. I probably spend about 20 minutes out of the 30-minute call, like with a case, talking about education and making sure they understand all of the basic details about it, which I'll happily go into later if you're interested.
Wow. So I guess, yeah, that's a big distinguishing factor is you get to build that rapport.
Mm-hmm.
Because like, in Toronto, for example, it's like you see someone new all the time. You might not see that person again. Whereas for you, you probably see them like quite a lot and you get
Yeah.
to build that relationship and that trust, which is, yeah, like you said, a great advantage. Um, and are there any internal and external education opportunities?
It's a bit of a challenge, actually. You kind of have to do your own due diligence as a public health staff at our health unit. Like, I mean, the wonderful thing is it's vastly encouraged by every single manager that I work with saying, if you want to do this course, if you want to do this, or you want to do that, then by all means, go ahead. But it's usually something you would do on your own time. You do your own due diligence around which one you think is the best for your needs. And also, I, as a contract staff, for instance, I don't get these funded by the health unit this time.
Mhm.
But it's not going to deter me from doing it. So I've already done, like, just recently I finished an immunization course online from it's from an organization like the Canadian Pedagogy Association, and it was a phenomenal course. And now I'm currently doing an infection control course, actually with Queen's University with two of my other colleagues together. So you just kind of do it on your own time, but I don't really get the time to do it during the course of my workday. So
Yeah.
it's very much independently driven, but it's obviously very encouraged. Like, I tell my manager what I'm doing and she's like, that's fantastic, good for you. If you ever want to discuss anything related to your course topics or apply it to the workplace, please let me know. So that's what I really expect from my managers. If I learn something that's valuable to what we can apply in our workplace, I get that support, which is great.
Wow. And how do you go about finding the courses, for example? Because I know you said it's all independently driven. Is it like word of mouth?
Definitely word of mouth is the biggest thing. Yes.
Mhm.
Like when I looked at the immunization course idea, my friend, who's another public health nurse at the health unit, she said, I've never done this course, but I've heard about 4 or 5 other people that have done it. So you might want to explore it, and it's not very expensive. And I was like, okay, sure. And then the Queen's infection control course, we just did our own due diligence around it. And then I just happened to find out that 2 of my colleagues wanted to do it as well. And we're like, well, let's all just do it together. Why are we doing this on our own? It's going to be 10 times easier. And then hopefully after we finish that course, we're hoping, because we don't really actually have a committee in-house around infection control. We
Mhm.
definitely work with partners, and I can certainly go into that, but like, it's something that I was thinking, once we get this course over with and we get the baseline information in there, we'd like to kind of get a little bit more in depth on this.
Oh, wow. That's really interesting. That's really cool that you get to go back and share what you've learned with your
Mm-hmm.
colleagues. And I know one topic in the news, especially with COVID-19, are resources. In
Yes.
Toronto, we hear about, a lot of facilities are sometimes low on resources. So have you ever run low on resources, for example, PPE supplies or immunizations for the community?
We definitely, in the early stages, like everybody else, did have a lack of masks. We did take the initiative to try and order them well ahead of time, which was good. We still had a decent supply, but we were saving them. And I
Mhm.
still encourage people at this point, especially because I know they can be expensive depending on where you go, or if you're just because especially a lot of people now are wearing the medical mask, which I'm very much in favor for. But we
Mhm.
definitely had a shorter supply of them, so we just had to adapt a little bit more to that. Now we're doing fine. We never really ran out of them though, which is fantastic. And the rest of the PPE we had decent stores of. We actually had like a huge storage of gowns that we had from back when they had the SARS outbreak.
Wow.
So we held on to those for a while. And then with regards to immunizations, all like regular primary series vaccines, never had an issue with that, even in the midst of COVID. We did have a bit of a challenge getting as many doses as we could of the Moderna vaccine, which is what we get up here.
Mhm.
But we did quite well. We just had to sort of remind people, it's like saying, you have to understand that booking is based on supply. I know the demand is high, but it's like, if we can't get all of these, and I was trying, because like a lot of the discussion, especially because this was a very, very hot topic, a lot of people are like either putting the emphasis on the health unit and the province and everything else. And they're just like saying, it's like, well, it's a global demand for this vaccine. So we have to be just continuing. And I always tell them, it's like saying, just because we have this vaccine and or we may not have this vaccine, your infection control measures are not going to go away. I'm not going to tell you that because you got the vaccine, you have to stop washing your hands and you have to stop distancing and stop wearing your mask. And that's something I think a lot of people were kind of expecting with the vaccine. So it's the infection control teaching really kind of comes more into play, I find, even with the vaccine. But the supply was definitely something in the early stages we had trouble with masks and getting the Moderna vaccine.
And I know you said before that with the shorter supply of, let's say, medical masks, and you had to adapt a little more with that. What does that mean exactly?
Making sure that you take good care of your mask. Like a lot of the time, like this comes a lot into the teaching we do with cases and contacts, is making sure you're wearing your mask properly, first of all, but also making sure if it's soiled, obviously we want you to discard that mask. It's no longer going to help you or anything else like that, but also storing it in a proper way. Like for instance, when we give out the masks, we keep them in little plastic or in little paper bags. And we just tell people, it's like, when you take it off, put it back in the bag. Or if you have a plastic container that you can seal it in, put it in there. That's perfectly fine. But don't just like sort of leave it sitting on the seat in your car, or don't just like throw it on the counter that you haven't cleaned for 4 days and assume it's going to be fine. You have to really think about how this virus is transmitted. So that's where more of the teaching comes into play. So I tell them, if you take good care of that mask, then it might be able to last you a little longer, but you have to be very careful. But again, if worse comes to worse and it becomes soiled or it's damaged or anything else there, then I highly encourage you to discard it and use a new one.
Mm-hmm. Wow, that's really interesting, because I guess we don't really think about, what happens to your mask if you're not wearing it. We just think, oh, we're protected, we have it on, but we don't think, oh, I put it on, a contaminated countertop, let's say, and we don't think about what happens next after that.
Exactly.
And I guess too, since education is such a big component of your role, how does health promotion and teaching strategies related to infection prevention and control differ across the lifespan?
The basic principles hold the same for every age cohort. It's the language that you use primarily, but the way that I find is using less it depends. I really kind of ask the person if they have questions at first. Like I will ask a 10-year-old, like saying, do you have any questions about like the hand washing stuff, or you have any questions about your mask? And like, because we start the conversation off in like very simple ways, but we get into sort of those nitty-gritty details and really sort of keep the dialogue as simple as possible. But I have to really sort of take an active listening role. It's like saying, do you want to talk about this? Or because I don't really like to force the conversation on somebody, but I will definitely have an immediate sort of discussion around certain things if I think that there's a concern. And masks are by far the easiest thing for me to sort of tackle, because you can see how they're wearing it when you first meet them. And that's a big factor for sort of tailoring the discussion. But the way that it tends to go across the lifespan is really sort of not focusing on the facts, focusing just more on how to use it. And I find using your hands-on approach of how you as a care provider do it is far more valuable than anything else. So whenever I have like an older adult coming in for their shingles vaccine, hypothetically, I show them how I prepare the vaccine, how I'm switching out the needles, how I'm washing my hands before, during, and after. And then we just have a conversation in between all those things. And a lot of the time they'll ask questions about like, why do you have to switch the needles? Or why do you have to do this? Or why are you wearing a medical mask and then a cloth mask over that? And why are you wearing the face shield? So it's really, I find people are kind of taking the initiative to talk about those things, as long as you just kind of keep the conversation open. But I always like to just kind of say to people, I'm happy to answer any questions you have. It's like, just ask anything you want. And then after I'm finished talking about it, if we get into the discussion, is did what I say make sense to you? Because if it didn't, I'm happy to sort of rephrase it or tailor it again. But I find the immediate actions of how I actually do everything, because then they see me, how I put the mask on, how you put the goggles on, and everything else helps them to get a better visualization. Oh, I wasn't doing this right. Or maybe I should ask about this, or why is the face shield being used versus the glasses? Or so I find the conversation tends to stay pretty open, but I always want to make sure it's like, did you understand what I said?
Mm-hmm.
But if you don't, please tell me, because then it shows that I have more learning to do on how I communicate with you.
Hmm. I like the way, like the points that you made about, checking in with the patient. Because when we talk about, I guess, health promotion, we're always concerned about, how am I relaying the information? But a lot of times I feel like, us as students forget we also have to ask questions and gauge where the patient's at.
Oh
Um,
yeah.
like you said.
And I think it's nice to kind of spread it out. Like one of the best examples, because we still give the students their vaccines and things like that. And a lot of the students are asking about the vaccine because some of them are not in the cage cohort yet, but they said that like eventually they very well might be.
Mhm.
So when we get into the giving them the vaccine, we still have to observe them for 15 minutes afterwards. And I like to actually take that time to sort of just talk with them and make sure they stick around, because I don't like them to leave beforehand. Because sometimes they'll kind of want to rush out the door because they're just
Right.
like, you just poked me. I'm very annoyed at you right now. But then I just be like saying, it's like, I love the design on your mask. Where did you get that one? Or it's just like, how's school going? Do you find it's like really exhausting? Or are you doing it virtually? Or how are your friends doing? And how are you guys like sort of keeping in touch? And they're just like, oh yeah, we play soccer, we do this, we do that. And then you sort of like talk about, so you throw in a few sort of basic details in between, like just saying, just sort of that makes it a little bit easier for them to understand. Especially because I like to sort of tell them, especially too, one of the easiest situations I find, and I get a lot of conversations like this, that I find is that there's a lot of youth wanting to go into healthcare.
Mhm.
So I asked them, it's like, do you know what you want to do when you're finished school? Or do you know where your aspirations kind of are going towards? And if they say that, I'm like, well, let me give you an idea of what you're sort of in for if you're ever considering public health, because this is what I do. And here's why I'm washing my hands. Here's why I'm preparing all this. And this is why I'm asking you all these questions. And it gives them a bit more of an insight that I think that they really enjoy, because they're just like, oh, maybe this is the area I want to go in, or maybe it's definitely not the area I want to go in. But I find that you have to throw it in small bursts. The one thing that I think is a bit of a challenge is that there's a lot of discussion that gets brought forward by the clients and the patients saying, it's like, there's a lot of frustration. There's a lot of COVID fatigue. And I tell them, it's like, I completely understand. I don't know what you're going through, but I can understand your frustration. And if any of that frustration is at us, let me know. I want to know what we're doing right, what we're doing wrong. Even if it's something I can't control, it gives them a lot of, it really helps them sort of understand where we're coming from. And I try to explain why these processes are in place. And then when I get that level of trust and I've taken their considerations into play, then I can do some teaching, because they can see that I'm listening to them, and then they take usually the time to listen to me. So it's never a defined process. Every single person is different, but the dialogue is just keeping it open. But also there are times where I've had instances where I try to talk about infection control and they're just like, no, I don't have any interest in learning about this. And I'm just like, I understand. But if at any point you want to talk about it later, here's my card. I'm happy to talk to you, but just when you're ready.
Hmm. Yeah, and I guess it goes back to the importance of building rapport with patients. And I know you talked about challenges. I was wondering if, connecting with isolated communities, for example, geographical factors plays a role in your ability to educate patients.
It's a huge hurdle for our area. For one thing, a lot of people, especially in our area and in New Liskert and Englehart, which are neighboring communities that are still part of our district, live in the bush. So for one thing, some of them don't have, especially some of these older individuals don't have cell phones, or they don't have cell service, or even Wi-Fi. So we've been having a lot of issues with booking people just for their vaccines. But also we have issues with just areas being inaccessible depending on the time of the year. Like, you would not believe the kind of winters that we have up here. We get like -40 weather,
Wow.
and yeah, it's pretty unbelievable. And the snow, like in my front yard, like all of 3 weeks ago, it was probably about 8 feet tall.
Wow.
It was unbelievable. It was like I had to get somebody to come and plow my driveway. It was just unbelievable how like much snow builds up over time on my grass. But we do try to adapt a little bit more to that. Like, we have mobile swabbing, and we have mobile vaccine clinics that happen, and we obviously encourage a lot of education at those times. We tell them what's the best means to get a hold of you since you're so far away, and what are you sort of physically capable of doing? Because like there are definitely some people in our district who maybe just don't have a vehicle, or maybe don't have, or may have a physical disability that make it harder for them to travel. So it's very much an existing thing, but we try to, when we get that interaction, is say, it's like, how would you want us to go about this in the future so we can make this easier on you?
Yeah, I guess like the main points that I'm getting from this interview are really meeting patients where they're at.
Yes.
Whether it is like we talked about geographic location, their mobility, or just adapting our teaching style to show that, hey, we're here, we're listening to you.
The one point that really just like, especially if you're like a student and you're thinking about going into public health or even any form of nursing, is you 100% need to know your social determinants of health. They are going to come into every conversation, and you need to taking notes on somebody's medical history and things like that is just as important, or like understanding what they're there for. But it's like, understand what they're going through. Understand, do they have access to a vehicle? Do they have access to care? Are they getting home service? Do they have housing? Like, everything comes into play. And that's something that gets written in the note, because then the nurse that works with them after is going to be like, oh, this is a bit of a challenge for them, or they prefer to be addressed by this name versus this. And so if you understand those social determinants of health and you actually implement them in sort of the casual conversation that you and I are having, for example, then it's going to serve you 10 times better in building that trust, and also really understanding where they're coming from.
Definitely looking looking at patients through a holistic lens is definitely important. So
Yes.
we've reached the end of this episode of Breaking the Chain with Caitlin. Thank you to our guest, Logan, for sharing your experiences working as a public health nurse in a rural healthcare setting. And thank you to the listeners for tuning in. Until next time.
Thank you very much.